Hello everyone. Thanks to all of you for liking my previous video which was on early identification and diagnosis of autism. As I have received many requests from all of you to share some more videos on management of children with autism, especially on toilet training, I have dedicated this video to share more information on toilet training in children with autism, especially for preschoolers. As we all know, toileting is an important milestone in normal development of a child, which is attained at the age of 2.5 to 3 years. And in children with autism, it is difficult to have this toileting skill because of their poor planning and organization skills. So, making learn this toileting skill in such children is a bit difficult and different from normal children, and it requires a structured approach which considers their strengths and weaknesses. In my practice, I have developed a 6-step toilet training process which has been very effective and useful, but it has to be practiced religiously and consistently. Then only results will come. So basically, this 6th-step toileting process has been divided into 3 categories. One is pre-toileting process, then toilet training process, and then post-training process. In pre-toilet training process, it has been further divided into 3 steps. First step is meeting the prerequisite skills. Prerequisite skills are very important before going toilet training, and these prerequisite skills are that your child must be able to sit on a toilet for 3 minutes. He should be able to hold urine for at least 1 hour, and there should not be serious problem behaviors. If it is, then it should be at relatively low level. If a child has already mastered some basic self-help skills, such as pulling his pant up or down, then it is good. So before going toilet training process, you need to work on these prerequisite skills which are required. When you will start working on this, these are the signs through which you will know that your child is ready for toilet training process. Again, if a child is able to tell you or show you through any sign or gesture that he or she has wet his or her nappy clothes, if he is able to follow simple instructions like sit on the toilet, if he is able to follow commands and pull her pants up and down, if he is able to hold the bladder for at least 1 hour during the daytime. After attaining these prerequisite skills for being a parent, you need to learn these simple strategies which are required for toilet training process. First strategy is you need to make this toilet training process very simple and break it into smaller steps. For example, go to toilet, pull your pant up. So in making your child learn these small steps in a sequential way. Other strategy which is used very commonly in toilet training is use of visual supports. Visual supports has been very effective in facilitating the toilet training process if it is done well. Another strategy which is again very effective in such children are encouragement and rewards. You need to praise your child verbally or through any other rewards also for accomplishing or achieving any steps or the completion of task. Another strategy which is again very useful is social stories. Through social stories, you can give concept of toilet training to your child. Social stories has also been very effective in making your child understand the need of going toilet, or giving the concept of why pulling pant or down, or why removing pant is important for going toilet, or why soiling pant in public places or in the family is not appropriate. So these are the four strategies which are very useful in toilet training, and you need to adjust all these strategies as per the need of your child. Once you learn these strategies, then you need to make preparations before toileting. This is the third step, remember. Preparations for making the toilet training process a successful one. Keep a record for a few days just to know the minimum interval in which your child is passing urine or potty. Usually I use elimination records for this to find out the minimum time duration or interval child is passing urine, because that would be the basis of planning a schedule or toilet training routine. Then preparing the environment. It means that that environment has to be distraction free. You should not you should make the environment as facilitative as it should be for your child. It may be incorporation of visual charts. It may be like simple thing like use of simple garments which is easy to remove and wear. Then make a picture chart. Make a picture chart through which you can make your child learn, or you can communicate your child very easily. Another thing is watch for signs for toilet readiness. As I told you that there are various ways child indicates. Some children just stand at a place, some children uh, touch their private parts. So being a parent or therapist, it is your responsibility to find out these signs of toilet readiness. Then identifying rewards. This is also very important, because if you don't know which reward will work, then there will be no meaning, or the child will not get the appreciation or confidence when he accomplishes any component of the task. So once you are done with the preparations, then this second phase, which is training phase. So how you get started in it is, once you set the schedule, this training process, usually I divided it into two components: schedule component and then accident correction component. Both the components are very important. Schedule component basically teaches your child the basic routine and the behaviors associated with toilet training. And the steps which are included in schedule component are like setting schedule, communicating with your child in a very simple way, making habit of toilet setting. So usually I recommend toilet sitting for 5 to 6 minutes, which your child has to learn. Maybe initially it will be difficult, but as you go on, it will be easy. Then again, the charts, visual charts which you have prepared, utilize that one for making your child understand. Use of rewards, positive reinforcement. And then the another component which is again very important, accident correction component. This accident correction component basically teaches the children about the request for toileting. And in accident correction, what we do is, when there is any accident about to happen or has happened, so you just temporarily interrupt that urination process of a child and let him finish the remaining activity in the toilet. And once he finishes the remaining part of the urine in the bathroom or toilet, you must praise him. And this is the component which will make your child learn the request process, the request for toileting. So schedule component and accident component both are important, and again you need practicing it for maybe for 1 week, 2 week, it depends on the child. Then once you start the toilet training process, you will also get many challenges like physical, maybe medical problems like constipation, kidney or urinary tract problems. So you need to consult to your doctor for this. If there is a language delay, then you may need other methods to communicate with your child. That your child may have fears. If the child is having some sensory problems, you need to take care of them. Body cues, again, earlier mentioned that you need to sense when your child need to go for toilet or not. Dressing, again, need for sameness, using different toilets. So initially you will be practicing this toilet training process at your home, but it may be that the child will get it difficult to perform in other public places or school. So don't worry about it. First practice it at home, then generalize it in other places, and it will take time. So these are the challenges which you might face while performing this toilet training process. Meanwhile, just keep practicing all the steps. Now coming to the third phase of this whole toilet training process, which is again post toilet training process phase, which includes certain points to be considered, like setting stick to the schedule, be supportive to your child, keep praising your child's effort and cooperation no matter how large or small it is, be calm and have patience, use the same words about toileting, make sure everyone is using the same plan. And above all, the key to success to have all these points done is keep language simple and keep toilet routines the same and never give up. So I'm sure, guys, that once you follow these steps properly and consistently, you will get a result in toilet training for your child. If you have any problem, you can always contact me. And if you want to have more information, then you can go through my website also. Thanks for listening, guys. I'll be giving you more information in my upcoming videos. Thank you so much.